town hall presentation. I'm excited to share a few more details of our Return to Campus Plan version 2. I know that we will continue to gather feedback, so your time and attention is really valuable. So let me share my screen so that I can get you more info. Here we go. Hopefully everybody can see the presentation. So I want to start by just reminding us of some of the key elements that we're navigating here together. So first, we want to make sure that we deliver a really engaging and authentic educational experience for each student. So we are committed to having that on-campus component if we can pull it off. We know there's value academically, social, emotionally in having the kids back on campus. And so we're working really hard as a team to pull that off. With that, the second principle is obviously the health and safety of the community. We want to make sure we're doing everything we can to keep everyone in our community as safe as possible and to put policies and protocols in place to ensure that that's the reality that everybody experiences. And then finally, we want to make sure we keep our community perspective on this. We all are connected and we all can contribute to the success of these plans that we put forth. We've got students with their interests and their needs that we're trying to serve. We have our faculty that'll be delivering this education and returning to campus to build their curriculum and help to engage students in multiple ways. And then we have the parent lens as well. And we know each family has their own unique story. So as we are putting in a lot of effort to get people on campus, we also know that for your story, it might be safer given your family situation to learn from home. And we want to honor all those decisions that each member of our community needs to make. So that's a part of our thinking as well. I wanted to spend a little time just to look at the calendar and to acknowledge that as we did that shift, I understand there could have been a little more clarity and detail in the reasoning behind that shift of timing of our calendar. And I do feel really strongly that the decision making was sound and that the work we're doing is in response to relevant data trends and needs that we have in our community to pull off a really safe return to campus. And so I want to give you a little more of that detail. So first, we're in looking at the calendar. We are at the town hall meeting. So we will use this as a time to share out more info, and I'm sure we will hear some ideas and feedback from the community as well. With that, then we've also engaged each family with a survey to get your interest to either plan to learn on campus or from distance. And so on August 21st, we hope we'll have all that data in, and that data will really help us make sure we've got the campus resources and plan in place, and we understand in terms of starting the year where our students will be engaging from. And then we will release version 3, which will have more details and some refinements based on the feedback that we've received. Those days between August 26th and September 4th are really important days, and that some of the feedback that we got from, especially from the medical professionals as they were reviewing our plan, is that our practices and our protocols are really sound. But we want to make sure that the reorientation for students to return to campus is really clear and understood by students, and that they are onboarded back to campus in a really safe and thoughtful way so that they can process why this work matters, their responsibility in the process, and also just a comfort to get back on campus. Many of the students haven't been back on campus for almost 6 months. And so a thoughtful approach to do that is really necessary. Our goal is to be back on campus, but once we're on campus, we want to stay on campus. And so making sure all of our community members understand these protocols is really, really important. So during those days, we will have some orientation, reorientation meetings for all of our students. Some of those will be small group, some in larger group, where then they will get reintroduced to campus. We may have a group that then actually utilizes our lunch system so we can work through those protocols that will be different. And again, a really thoughtful re-entry to campus is what we want. And so we're going to use those days, and you will hear more from the divisions with details about those days. That'll be a critical time that we all get reacquainted with some of the new elements to the campus here at Wellington. And then we'll have our first full day on September 8th where everybody will be on campus together, and we're certainly looking forward to that time. The other element to the shifting in our calendar was related to the data. And the data around prevalence of COVID-19 in and around our community, our state, our county, and beyond. And so we've been tracking that data very carefully. And as Franklin County Public Health Department came out with a recommendation to schools to consider distance learning, that we wanted to really study those data and understand what that recommendation meant to Wellington and the policies and protocols that we can put in place given our small size and our campus and our amazing group of educators. So we wanted to really study that carefully. So part of the data that we study comes from the state of Ohio data set, and I'll just show you one example here. And so this is the number of new cases that are emerging. And what we could see a couple weeks ago is that the trending on the data seemed to be trending down. And we anticipated and also got feedback from medical professionals that are also tracking the data, that with a little more runway, a few more weeks, that the anticipation was that the cases would continue to decline, and Franklin County and hopefully the state would be in a stronger position where for us to think about really managing our protocols on campus, but also then the opportunity to limit the likelihood that COVID would come to campus through the members of the community. So by pushing that date, it buys us more time with the data. And as we're seeing now, the trending is in a positive direction. So we hope that'll help us keep all of our students and faculty and community members safe. So we're tracking the data carefully, and that was also a key piece of our decision making. I wanted to highlight a little bit of the types of resources we use. There's been a lot of questions on and what things are we watching and looking at. So obviously the state of Ohio, the data trends I just mentioned. As you know, there are risk levels that have been connected to the different counties. Some schools are utilizing those to inform their policies. We're tracking that, but also having conversations with Franklin County Public Health Department directly about Wellington and our plans and how those data should impact what we're doing. We had a conversation with that group yesterday where we shared out our full plan with Franklin County Public Health and walked them through the details of our plan. They have an awareness of our campus and could give us feedback about elements of our plan, but feel that we're taking very thoughtful and conservative approaches to health and safety. And so they were happy to hear about our protocols and policies, and they are available for further consultation. I'll mention a little of that later in my presentation. We also monitor the CDC data and their guidelines. And also we have the gift of having some medical professionals in and around our community, and we're staying connected with those, and especially Dr. Andrew Thomas, who consults with the state and also has helped us frame out and get some perspective on our plan. He did a session with our full faculty where he was able to frame how the COVID concerns would have interplay with our school community and the things that we have in place and the ways to keep everybody safe. So that was a great resource for us. Watching national organizations like Academy of Pediatrics and using the National Association of Independent Schools and ISACs to look at best practices. What are other schools doing? What other strategies are schools using to deliver education while also keeping everybody safe? We're watching current publications to see especially how the data is coming out about transmission rates and how different demographic groups are impacted by the virus, and we can be responsive as new findings emerge, the prevalence on surfaces and how to best treat surfaces. Those kinds of things are things we'll continue to track. And then finally, I just wanted to mention as we watch and hear the stories that are out there, and we want to learn from those. We want to learn from what other places are trying and doing, and if we can be better from those lessons, that's valuable. But we also want to always scrutinize those stories to say, does that apply to the approach we're taking at Wellington, where we have 6-foot distancing everywhere and we have mask wearing throughout the day indoors? So some of those stories come out and they don't have those same precautions. So I just ask that we always put that lens in how those stories might apply to what's going on. but we're watching the new research, and we will incorporate elements into our protocols as needed. As I mentioned, protocols, I want to just kind of show you a list of some of the key elements. The 4 areas that are really critical that we are making sure are in place. And also, if you saw Governor DeWine's presentation a couple days ago, he also had a pediatrician on that reaffirmed these issues, as well as schools are opening up in Ohio. So the 6-foot distancing everywhere on campus in all of our school spaces, that is viewed as a conservative and appropriate distancing if you can pull it off, and we can. And so we've already got classroom and common areas set up with that 6-foot distancing, along with mask wearing. So anywhere we are indoors, students and faculty will have on masks, obviously, as we work through lunch, and then also try and incorporate some mask breaks where we can utilize outdoor spaces and how we can manage those times when masks would be off. Those are some of the things that we stay really connected with Franklin County on to get some guidance on that. Hand washing throughout, including adding some portable sinks in some lower school classrooms, and making sure we've got protocols and reminders for students. And then high touch surfaces will be cleaned consistently throughout the day, both in the flow of the day and then a deeper cleaning at night. We have modified our lunch program, so lunch will actually be delivered to students, with some students sometimes in the dining room, and we'll have a rotation on that. And other students will either eat in classrooms or common areas, or hopefully the weather will be cooperative this fall and we can utilize our outdoor spaces as well. We will have a arrival and departure, which we know is already, always a highlight of people's day, right, Caroline? So we will manage the doorways and really find some balance in how we have that flow of students on and off campus, and try and have that one-way spaced flow for students to minimize that, and some more details coming in the next version related to that. We will limit visitors on campus, and I know that'll be difficult for some parents who I love to see in the hallways and are part of the community as well. But for safety and for management of controlling what we can control, we will limit visitors. And so for the most part, students will be dropped off at the door, the external doors of the school. We've made a modification for the little JAGs, where they will be in that external building that was an early childhood building in its initial iteration. And so we'll modify that. So little JAGs will actually be able to walk right up to the door and be dropped up at their classroom. So for our youngest learners, we know that'll be valuable for families. Now, we won't be having field trips. For now, we will find ways to Zoom or find video interface with outside groups to bring that awareness and those connections to our students, while also keeping safety key. And then finally, we want to make sure we continue to emphasize for students and faculty that if they are feeling symptoms, if they're not sure, not feeling well, then they should plan to stay home, and we'll make sure that they are supported in that decision making. Also, obviously, information about ventilation and the importance of that. So we have looked at all of our HVAC units and increasing filtration to this highest level that's recommended there. Looking at how we can program those units and also use windows to increase the fresh air, the outside air, to help improve that ventilation as well. And then in spaces where there might not be outside windows, bringing in some additional mechanical filtration to improve air quality as well. We will also really try and expand the use of our outdoor spaces in our campus, and looking at PE and recess, and utilizing our fields and playground areas, while also building in more spaces. And so we're excited to build out some tented areas that also add some outdoor Wi-Fi capabilities that'll improve the ability for teachers to be able to move outside, to have a learning experience, or during lunch or advisories, to really utilize those outside spaces to their fullest. So we're excited to do more of that. We also want to emphasize again that this is a community approach. We all have responsibility for our own health and safety, but this is a really unique situation where we really need to take some ownership and responsibility for each other's health and safety as well. So we will be pushing forward a community commitment The Board of Trustees has shown a real interest and willingness to push this forward as well, because they want to demonstrate their commitment, knowing how important this is. We can control the things we can control on campus, and if we don't have good partnership or there's things going on beyond our campus that add risk, then that's problematic. So we are going to be asking every family to do everything they can to keep their own family safe, to limit the exposure as much as they can, so that as we get students back on campus, that we can stay on campus. So our plans and protocols are really sound. We feel good about it, but we're also asking the greater community to make a commitment to help us stay safe. With students, we will have an elevated expectation for their behavior on campus, especially as it relates to health and safety. So we'll have some agreements with students, developmentally appropriate, of course, where how they move through the campus and work with one another needs to be mindful of the health and safety needs that we have. I wanted to highlight an area of the educational delivery and a really exciting elevation that we've added through technology and investing in technology. So as we've mentioned, this high flex approach, we know teachers will be equipped to do that in-person education. That's obviously foundational to the work we do. They will also be building in the capability to do what we're calling synchronous distance learning. And we have equipped all of our teaching spaces with two-way audio video feeds. So basically a live feed for both video and audio. And what that allows for is really two unique aspects of our programming. First of all, as we keep our instructional groups small, and you'll learn more about those in a second, as we keep those small enough to maintain the 6-foot distancing, in some classes there may be supplemental spaces that need to be used for teaching and learning for students that are in that same class, but aren't in the room because of the distancing. So we are calling that a remote on-site situation, where that student will still have the live real-time classroom experience, even if they're on campus but not in that classroom with the teacher. So that's one aspect. The other aspect that's really unique that we didn't have in place in the spring for that learning from home was that a student that chooses to learn from home and we are on campus will then utilize a real-time classroom experience. So they will be on a large monitor in the classroom with real-time audio video. The teacher can call on them and they can ask questions. They can participate in the classroom discussion. And so that will allow a highly dynamic, highly connected experience, even for those students that have chose to learn from home. We've got a little test run of that happening right now, our summer program that we were really excited that a lot of over 200 students took part in classes throughout the summer. We have one right now that's serving as a pilot for this two-way audio video, and it's a strings class with Ms. Butler. And so we have a set of students that are on campus and a set of students at home that are at home, and she is teaching strings through this audio video interaction. I was in there to watch it. It's a great experience, and so we're really excited about that technology. And then finally, the asynchronous work, that would be the classwork that the students would be able to complete at their own schedule. So that obviously continues for both the on-site and off-site, as the typical classwork would flow for any given academic experience. So the key for this was really to build in that optionality, an optionality that's meaningful, that a student that goes off campus isn't missing out on significant components of that learning experience. And so we're really excited to present that new model in this high flex approach. So I wanted to give a little bit of background as well to the feedback that we received. There will be digital platforms that we use. Even on campus, we'll be interfacing obviously with students through these platforms. And so we took the feedback from the spring experience with learning from home, and we've studied that and we've made some modifications. So a few of the concerns that came out, the platform variety and logins. So trying to track which thing do I log in when and what's my password. We heard clearly that feedback was around, could we streamline that? And so we've added a software called Clever, and we've tried to get to a single sign-on approach, and also elevated the training for faculty with Veracross, with Google Classroom, and with Seesaw as our primary platforms so that families really have a strong understanding of how to get that initial interface and get their students set up for success. Also, communication, information coming in at different times in different places, and again, trying to track that. So making sure we have a more of a weekly curated communication where we're looking back to share what's been done, but also looking forward so families can plan effectively for the work. And then also making sure we're elevating wherever we can that synchronous connection, the small group or even one-on-one connection between the teacher and the student. If they're learning from home or distance, we want to make sure that our model allows for plenty of that work, because I know that's so valuable to students and families. And then I wanted to point out that if for some reason the state mandates or the county mandates a learning from home situation where we can't be on campus, I did want to make sure that you're aware that we would be building out a pandemic childcare model that would allow for supervision of our early childhood learners on campus. So I wanted to make you aware of that. A few definitional things that come up and are used, terms like cohorts. So I wanted to talk through the idea of a cohort and see how it applies to our work. So first, kind of the most extreme cohorting model, and this isn't currently in our plans, but I think it sets up an understanding of cohorting in a thoughtful way. So a minimal cohort model would be a model where you have one small group of students in a space with a teacher, and they don't go anywhere and nobody comes into the room, and it's sort of this very controlled structure. Okay, with that, you buy in that ability to really control things, but you lose some variety of educational differentiation that you can do, some of the social emotional connections that you can build, and some of the variety of programming that you can offer for students. So there are some significant limitations to that model. As we looked at that model, and we also looked at the safety protocols that we have in place, we have decided to move away from the minimal cohort model while keeping really strict safety protocols, but allowing a little more mixing and movement of students in the school day. And that allows for some differentiation and some educational flexibility that we think is really valuable for the students. We have this model in mind. If we needed to pivot back to it, if we thought that that was a meaningful and important shift, we could do that. But right now, we are not in the minimal cohort model. What we are doing is a modification of that where we control most of our groupings through these small groups we're calling instructional groups. Those are in the classrooms, and those are, the size of those is really dictated by the safety of that spacing in the classroom. So where we put in the 6-foot distancing, that defines how many students can be in a room, and that we're calling an instructional group. So for example, a 5th grade science class. So we know in the 5th grade there are multiple science classes. An instructional group would be one of those 5th grade science classes in that room at a given time. For us, a cohort really defines the level of mixing that occurs for any given group of students. So in this case, for the 5th grade, those 5th grade students will sometimes be in that science class, they'll sometimes be in a math class, and they may be in a different classroom and with some different students during that time, but we will always have the 5th grade in those groups with 5th graders. So the cohort is the 5th grade in this example. And if we had a quarantining situation, we would work with Franklin County to identify what level of mixing and contact happened, and we may quarantine at that cohort level. And we'll get guidance from them, and I'll talk more about that in a second. But that cohort level is what's the level where the students are actually having some interactions with others. And in most cases, we're dealing with a grade level cohort at Wellington for our plans going forward. Again, the trade-offs are the smaller cohorts, you get some limitation in what you can offer, and the programming is very constrained. And the larger cohorts allow for these embedded groups where you can get a little more curricular variety and differentiation. So that's where we put our emphasis, given we have very conservative health and safety protocols in place. So just to give you a sense of what that looks like in lower school, middle, and upper, we have these in lower school, a lead teacher with their instructional group. There may be some mixing of those groups to do some extension work, to do some differentiated learning. The specials teacher, we still have special areas that we want to make sure students get to experience. So those special area teachers will be connected to a given grade level and then rotate. As the year goes on, they can also use that remote on-site teaching to still interact with the other students. But at the lower school level, if we had a case, we would immediately contact Franklin County Public Health Department. They would look through our seating charts and our instructional group guidance that we give them. They would then be able to help us inform whether a quarantine is necessary. And they would inform our communication to the community. So it might be, we would alert the community there has been a case in the 5th grades. Please be vigilant and watching for symptoms. Or it might be we've had multiple cases in the 5th grade. They see a connection. And so they help us determine that a quarantine at the 5th grade level would be appropriate. So at each division, we will have this quarantine level that's somewhat dictated by our cohorting, but also dictated by the connection with Franklin County Public Health and their guidance in any given situation. So we will utilize the cohorting and grade level work and the amount of mixing at each grade level. I'll give you a little more detail through the different divisions. So in lower school, we have, as I mentioned, the Little Jags out in those, what's now the Strings building, but it'll be an early childhood building. They have a central bathroom and we can do drop off there. For the other students, they will have a homeroom teacher in the main building, and we'll have some learning support positions that help float and work within a grade level to support the needs of teachers and students. We'll have the special area teachers, again, connected to those students. And we may use the longer breaks to mix those groups a little bit, again, to get that social emotional connection and the teaching connections across that grade level. We will still have PE and brain break. We're looking at the utilization of equipment and what kinds of things we can have the students using during those times. But we have our large spaces on campus, guard gym, board gym, roar, our fields and playgrounds available so we can space out the students and let them have some of that physical activity that we know is so key. Lunch, I mentioned, will be delivered, and then the no field trips in lower school. Middle school, similar in that we've got these instructional groups that then may mix across grade level. Continue to look at how performing arts integrates in the program, and also what the schedule and rotation will look like. Right now, it's looking like a 4-day rotation with a 5th day that has a little more flexibility in the curriculum that families will be able to determine how to best interact with those days. But again, secondary spaces that we can utilize for those secondary sections, and also give supervision to students where they are appropriately spaced in BPAC or Performing Arts Complex or Commons, and also Russilli. So utilizing all of our campus spaces to keep that middle school group sort of in a larger area without a lot of mixing across divisions as well. In upper school, similar model again, where the instructional groups are in those classes. We may have the supplemental or secondary sections where we had larger enrollments in a class and those students want to stay in that class. They can then access that remote on-site. We would rotate through to make sure students always have some time with the teachers in those classes. The commons areas upstairs and also the learning center will be available, again, to space out and supervise students. And a 4-day schedule with 2 A days, 2 B days, which will follow a typical upper school schedule. And then a 5th day where we can build in, again, some of those really unique program elements like advisory clubs, student council, where students can then come to campus. Also with those outdoor spaces, there may be opportunities where students that are choosing to learn from home, there may be opportunities to come on campus to be outside. So whether that's under a tented area for an advisory or a affinity group meeting that we might do outside. So again, trying to build in those connections for everybody in our community. Being thoughtful about how we move through our hallways, and also locker access for both upper and middle school, whether that's a morning and afternoon access, and managing that very carefully to minimize the amount of time, as Franklin County says, just limit the amount of congregation. Keep kids moving through those spaces, and then that'll help keep everybody safe. So we've got that in mind, and whether and how Sokol Store and sort of the upper school might utilize that with snack, and so management of that is on our mind as well. Some other just big picture detail things that are probably on people's minds. Busing. We will still continue to have bus service to the campus. We have 2 layers of that. We have a Wellington bus that runs a specific run that's not connected to a district, that bus will continue to run. And then also, even if the districts are in a virtual mode, they will still provide busing for our students. We will have capacity limits on those buses. We will ask siblings, where possible, to sit together. We'll have windows down. We'll have masks on the buses, and we'll have seating charts that, again, if we need to do some contact tracing, we can do that. So busing will continue, and we'll have pieces in place to keep that safe. Again, the mention of the pickup drop-off, utilizing different doorways and time windows, and we'll ask families to honor those so that we can have a nice, easy flow into and out of campus with multi-divisional families, allowing you to kind of pick which time window works best for your family where that's possible. And we'll make sure to try and meet families where they are to ease this challenge of getting on and off campus, and helping the students to understand as they move in and out of the building how to start the social distancing awareness. Aftercare, looking at how we build that program out, the early childhood program need, and then do we need to layer in, is there interest and need for other grade levels while maintaining that cohorting and that really careful curation of the student mixing, so that we provide that really important service to families while also keeping things as safe as possible. We also will limit, as I mentioned, visitors to campus, and one of the key pieces that's impacted are substitute teachers. So we will not be bringing in outside substitutes. Instead, we are investing in what we are calling learning support staff. They will be an in-building learning support team, so that as we need coverage, we will pull from members of our community to cover those classes. If a teacher needs to teach from home, then we will have educational support in that classroom where their lesson comes through to then guide the students. So we are investing in these learning support team members to help us execute this educational model. We will have one moment for admissions, we think Saturday morning, where we will do some admissions tours. We know for prospective families, seeing the campus is so important. We want to honor that and do it safely for our community. And so we're looking at a Saturday morning window where we might allow some tours of campus to see our spaces. As I mentioned before, continuing to look at performing arts, singing and wind instruments are obviously a lot of study and research going on, and looking at how to best execute the performing arts, which we know are such an important part of our community, but while also keeping safety paramount and trying to find that appropriate middle ground for that. Student supplies have been on our minds, and we've got individual supply kits that will be provided for lower school and middle school students, and also students with technology to have their own technology. And because of this remote on-site potential, then we want to make sure middle school and upper school have the headphones, so they'll be able to engage with academic work if they're in these other more common supervised spaces. And then finally, again, lunch will be packaged. We'll provide lunch. It'll be delivered to students. It'll be a mixed group, good variety of nutritious and tasty treats for our students. And so the idea was to have that delivered in prepackaged containers, again, for safety. We are getting feedback about that system, and we want to work with families to better understand families that have dietary needs or interest to bring their own lunch. So that's under current study. Feedback's been helpful, and that'll obviously be a key piece of this final version as well. And so I think I've hit most of the key elements of the plan. I do think we have some time for a few